this concept right here is just trying to look at like the possible things you need to do for patients that actually have what hernia. All right. So pre-operation preparation and evaluation. So the whole thing is like, okay, before you do an operation for any patient that has hernia, there must be some things that what must be on ground. There must be some information that must be on ground. You don't just go straight up to what the operation, right? There are some pre-operational what practices, okay, that you need to actually know, okay, for hernia patients. So you can see this is a doctor trying to palpate for yeah, just trying to track down it's a paraumbilical hernia, and they'll palpate right down to see if there's inguinal femoral hernia and all that. Okay, so the preoperative preparation and evaluation for hernia patients actually include, before you do a surgery for a patient that has hernia, at least you must get their medical history. Okay, so assess their overall health and identify the potential risks for going into that surgery. Okay, then it will also help you assess the risks for the type of surgery you are doing. Do you understand? It will help you know which type of surgery you should opt for and all that. Okay, then you should also review medications they have taken and also review their allergies and all that. This will help you know which type of drug to actually give to this patient. Okay, can you see how important this is? Then for physical examination, you look at the hernia physically. All right, so you evaluate the hernia and the surrounding tissues. Okay, then you also assess for potential complications, like if there's possibility of bowel obstructions and all that. All right, then laboratory tests, you could do a complete blood count, you could do some electrolyte panel. All right, you could do liver function tests, then you could do coagulation studies if necessary. All right, then imaging studies, like you want to actually look at what the hernia, you want to look inside, actually know the extent, okay, before you cut. Okay, so you could opt in for ultrasound, CT scan, just to confirm hernia diagnosis and rule out other conditions. Then anesthesia evaluation, that's you are going close to the surgery now, so you have to know which type of anesthesia are you trying to use. Is it the general one, or is it the one that is just regional, or is it just a local anesthesia? All right, the informed consent, you have to let the patient know, right, what is happening, and if they actually what give 100% yes to it. Okay, so you discuss the risks, the benefits and alternatives to the patient. If there are so many other surgeries that it can be done for this, then you always tell the patient, okay, so that they can opt in for the one they want. Okay, then not really the one that they want, you can also advise them, okay, counsel them on the one that is the best too, if you feel like there is one that will work well. Do you understand? Because you are the medical professional here. The optimization of medical conditions, you should manage chronic conditions like diabetes, hypertension before going to the theater. Then if the patients are taking any anticoagulation medications, then you should stop. Okay, then bowel preparation, you should clear liquid diet or bowel preparation if necessary. All right, so these are the different types of what hernias that we have. It could be umbilical, incisional, inguinal, epigastric, spingellian and femoral. Then you can also give some antibiotics prophylaxis, that's like before, like even the surgery, just to prevent any possible infections that will come up later. So you can administer antibiotics just to reduce surgical site infection risk. Okay, then patient education, explain the procedure, recovery and post-operative care. Okay, so evaluation of hernia patients will also include the following. You could do a hernia classification, you access for the hernia size and location, you evaluate for the surrounding tissue quality. All right, then you identify potential risk. Okay, identify like the possible causes of that hernia that the patient is having, so that I can advise them, okay, to avoid that. All right, so that's the pre-operation preparation and evaluation that could be done for hernia patients. See you guys pretty soon.